My liver cancer surgery experience, it started in December of 24, just about 5 months ago. I had gone to the doctor for my routine annual physical and got my blood work, and my liver enzymes came back a little bit high. I was like, okay. So the doctor decided, let's do an ultrasound. I get the results of the ultrasound back, and they tell me I have a huge mass in my liver, stage 3. And I was floored. Like, stage 3, what? Doctor said, I don't know, but it's stage 3. Okay, that didn't help me very much. So we said, let's do some more tests. So we went to the CT scan. That came back adenoma, benign liver tumor. The ultrasound came back benign liver tumor, adenoma. So after the CT scan, we said it needs to come out. It's very large, regardless of what it is. So we decided we went looking for a surgeon. And I was fortunate enough that living in Florida, I was close to a very good cancer hospital. And we got a couple of names recommended to us for surgeons. We interviewed two of them. The first one was a younger guy, and he thought he could take it out with laparoscopic surgery. And a little incision and a huge tumor did not make sense to me. So we interviewed the second doctor, and he was awesome. 2 minutes in, I knew that he was my man. Very kind, reassuring. He said, I think it's an adenoma. Let's schedule surgery. So we did. From the time I found out, it was mid-December that I had this tumor. And I had surgery, open resection on January 23rd. So it was about 5 weeks. We moved really, really fast. And there was even a 2-week delay in there getting a CT scan. So, but anyway, we had the surgery. I had an early morning surgery. My surgery lasted about 6 hours, and I spent a couple nights in ICU. They moved me to just a normal room. Second day, they took out a catheter, which was okay, which was great. But when they take that out, then when you have to use the restroom, you have to get up. That was tough. That was really tough getting up because the incision was huge. It was an open resection. The tumor was as big as a cantaloupe. And so they had to really open me up. So I got up. Once I was up, it wasn't too bad. It was just every time I had to use my stomach muscles, it was pretty agonizing. But once I was up, I was fine. I tried to walk as much as I could in the hospital just to get up and move around. First couple of days, they put the air compression socks on, and that helped with like blood clots and stuff. So anyway, I went home, and I had my best friend from Charlotte. She came down to help take care of me for 3, 4 days. My husband was there to help as well. Um, I got up, tried to walk around. I stayed on my meds just for a couple of days after I got home. I'm not one to take, I don't like taking medicine at all. So I wanted to get off of that stuff. So I tried to get back to normal, doing normal things. We took a road trip about 10 days after the surgery. Big mistake. I probably would have waited a little bit longer before I did that, but it worked out okay. I survived. Um, So now I'm 3 weeks later, I had my appointment with the surgeon. I had no idea what it was. I was waiting for pathology. I just thought it was an adenoma, and yay, I got the adenoma taken out and life is good. So we get to the doctor's office, and he said, did you get your results online? I said, no, I haven't been able to find them. I said, what do we have? And he said, you have hepatocellular carcinoma. And I said, what? And he said, cancer. And I was like, what? Because all along, everybody thought it was a benign tumor. So that sent me for a loop. But he was very reassuring. He gave me great prognosis. My liver is perfectly healthy, other than that tumor that grew in it. So they were able to remove 60% of my liver. The tumor was inside the liver. So it hadn't spread. Even though it was so large, stage 3, it did not spread anywhere. I did have a couple of satellite nodules that the surgeon said was a cause for concern because the tumor had progressed a little bit, but all the margins were good. The tumor hadn't infiltrated my blood or my nerves or anything like that. So I didn't need any follow-up treatment, which was awesome. All I need is surveillance now for the next 5 years. And I've gotten my first set of tests back and everything's good. There's no sign of anything. My liver grew back. It's normal size and functioning great. I have no restrictions. I'm at 9 weeks, I was riding my horse again, going camping, and I just healed up very well. So I'm very lucky I found that surgeon. I'm very lucky we pursued to find a good surgeon, and we kept asking questions to get answers that we needed.